Papillary projections or amorphous materials. This was a 23-year-old with primary infertility. She presented with a 2-year history of abdominal pain and swelling. She also volunteered a history of weight loss. On examination, though well preserved, there was evidence of weight loss. There were no other remarkable findings on general physical examination. On abdominal examination, the abdomen was tense with a largely cystic, non-tender mass which was equivalent to 40 weeks gestational size, and there was no ascites. Ultrasound done after consultation revealed a pattern recognition which was consistent with mucinous adenoma with a strong differential of mucinous borderline ovarian tumor. So she had the basic investigations, and within 5 days of consultation, this patient had exploratory laparotomy, where she was coming from the hinterland. This landmark paper defines what solid means and how to differentiate blood clot from solid tissue. By the IOTA consensus definition, solid means exhibiting high echogenicity, suggesting the presence of tissue. Example, myometrium, ovarian stroma, myomas, and fibromas. The paper went further to say methods to distinguish between blood clots and presence of solid tissue involve pushing the transducer gently towards the structure and looking for internal movement. This presupposes that it's a transvaginal approach, and use of color Doppler imaging. The presence of flow with appropriate setting is diagnosis of solid tissue, but the absence of flow is not informative. He went further to say that in cases of doubt whether it's a blood clot or a solid area, the lesion should be classified as solid. Now, these are the examples of what solid means, like the echogenicity of the myometrium, fibroma, ovarian stroma, and fibroids. So this is the video showing the bladder here. Part of the vagina is seen here. The cervix. So not this huge multilocular cyst which extends from the pelvis up to the xiphoesternum. Not the different cyst contents. Here you have low level echoes. Here is what looks like ground glass appearance. These are features of mucinous tumor, not the stretched out uterus there, and what looks like the honeycomb nodule here, which is a feature of mucinous borderline ovarian tumor of the gastrointestinal type, not the regular septae. At times, clumps of mucin are seen here, may be mistaken for solid lesion. Are these papillary projections or not? So here you have a schematic diagram. This is a cyst wall. Here you can see the cyst wall here, and look at this structure here. Look at this structure here. So the measurement here is up to 8, so it's more than 3 millimeters. Note the measurement excludes the cyst wall. So is this a papillary projection or not? When in doubt, you can use a transvaginal probe and push the area of interest. When the structure moves, it's unlikely to be a solid tissue. But here we have a huge mass, and what we use was trans-abdominal. But the principle is the same. So let's see. You see that? It moves on pressure. So this is unlikely to be a solid lesion, and therefore is not a papillary projection. Secondly, with a proper setting, we can also use color Doppler. And what do we have here? It has not taken up color. So this is not solid tissue, and therefore it is not a papillary projection. Now, why is it important to correctly classify this lesion? This is because if this lesion is incorrectly classified as multilocular solid, the risk of malignancy is up to 41%. But if it's correctly classified as multilocular cyst, the risk of malignancy is 10% outside pregnancy. The risk in pregnant women is even higher. So it's extremely important to correctly classify these lesions. But when in doubt, assume the worst case scenario. So the final diagnosis in this case was mucinous cystadenoma. So our take-home message is that the knowledge of iota terms and definitions and its correct application will improve quality of care of our patients. Thank you very much for listening.